Hello, my name is Cortland Lee, and this is a presentation on the Hopewell Fire Department response to COVID-19. Our department response policies are as follows. First of all, we've implemented pre-arrival questions to all people that contact emergency services. First question is, has the patient traveled outside the country in 21 days, or has the patient tested positive or awaiting a response for COVID-19? Fever and cough with either contact with a COVID-19 patient or fever. And then if the answer to any of these questions is yes, then they will be put into the response notes of positive BSI. And if the answers are no, then the answer is negative. And those are added to the dispatch notes when we get the call. Other policies are after a suspected case, providers must decon the ambulance with Firex decontaminant, which is what we've been using for all of our decontamination. They have to change clothing at the hospital and then upon returning to the station, shower and wash all of the clothes. Some of our other response policies is we have canceled all non-emergency calls, including lockouts, pub ed events, smoke detector installations, and outside training. We have canceled all station fill-ins between mutual aid agencies, but are still doing mutual aid responses. We just will not be going into the stations for cross-contamination purposes. We have also added the Virginia Office of EMS COVID-19 worksheet added to all of our image trend calls. And we do that for every call that we run. And we are following and implemented all of the ODEMSA COVID-19 protocols. If we were to have a positive BSI protocol, then the providers don the N95 mask, gown, gloves, and goggles prior to entering the structure and prior to patient contact. Upon patient contact, the patient is placed on an N95 mask as well. And then we will contact the hospital and notify that they have a positive first contact pre-screening, which is a worksheet or form that we have in our ambulances supplied by John Randolph. Some of the changes we've made in the station to respond to COVID-19 is that we are keeping both of our stations from visiting each other for any reason other than essential task. We are cleansing all high contact surfaces every day in the station, such as doorknobs. We have canceled all outside visitors to the station. We've canceled all outside food being brought to the station unless it's coming from a grocery store and or a restaurant. Decontamination of the ambulance with Virex decontaminant every morning and afternoon if that ambulance has responded to calls within their shift. And we have also canceled all grocery store trips, so we are having to bring our own food from home. Some of the challenges that our department has faced, with Hopewell being a small department, our biggest concern at the moment is staffing. Our response model for that is at 15% reduction or 2 people less than what we normally operate at. We will no longer staff our quint, which is 1 person, and go to two on each engine, and then staff our third out medic to help respond to medical calls. At 30% reduction, we will be operating with 4 less people than we usually do, and we will no longer staff the quint, no longer staff our third out medic, and go to 2 on each of our engines. So far through this point in time, we have only had 1 positive case of COVID-19 coming from Hopewell, which our services did not transport and take to the hospital. He was self-admitted. All policies have been followed accurately by the crews, and we have had no major exposure incidents.